all the people who are joining us for the first time. So I request as ground rule, all of you need to understand that our messages will happen only on the WhatsApp inner circle. So I'm reading your messages. So all the people who have joined in for the first time, I request you to get recognized and identify yourself. जरा ये fan बंद कर दो, please. Yes, so you can just put up in the chat box till others are joining us. Let's just recognize everyone who has joined us for the first time. I can see a lot of familiar faces like always, but I also see a lot of new faces. Hello, good evening. So all those who are joining us for the inner circle for the first time, please just can you put us your name and your location so all of us can tell hi to the new people. Dr. Narendra Saraswat from Ghaziabad. Good evening. Good evening. Hi. So all those who are joining inner circle for the first time, can you just identify yourself if possible on the display name? Keep your name. Don't keep as a mobile name or something. It becomes difficult to identify you. Hi, Dr. Ankit Desai from Ahmedabad. Hi. Nice to see you. Dr. Sunil from Tamil Nadu. Welcome, welcome, Dr. Sunil. We'll just take a minute more before we start. Dr. Anshu joining for the first time, I request you to identify. Now, any one of you who has Dr. Reni Kerala, hello. Any one of you who has attended 2 or more inner circle sessions so far, can you identify yourself? Anyone who has been regular in attending the inner circle so far? We'll just take a minute more before we start with the presentation. I see a lot of people joining in and I don't want them to miss out on anything new. Hi, Dr. Adarsh. Hi, Dr. Adarsh. Nice to see you. Dr. Ansh just joined. Yashwant Patil. Hi. Dr. Sumit from Ghaziabad. Hello, Dr. Sumit. Dr. Ankush Srivastav. Hi. Dr. Meena Kambe, madam. Always been there. Dr. Vinod from Tamil Nadu. Dr. Sunil Prakash. Hello. Dr. Sachin from Satara. Hello, Dr. Sachin Borgave. So nice to see all of you once again, and I hope to give you another value add session to all of you. So can we just start? If all of you just agree, just put start in the comment box. Let the comment box start buzzing on our WhatsApp group, and let's, yes. So all of us are ready. Let us just start. Let me just pull up my presentation screen. Excuse me, Sabita. Yes, I'm just trying to enable my screen sharing. Give me a minute, please. Dr. Sumit, yes, hi. We will start surely very soon. Dr. Muralidharan from Tamil Nadu, yes. Hello, Dr. Muralidharan. And Dr. Sumit Kaur, hello, nice seeing all of you. Dr. Reni, yes, we are starting. And so this will be a small, very quick brush up for everyone who is new so that all of us are in sync. So when we come to the R-line implant system application, broadly, the implant system is divided into single piece and two piece implants. Now, what we mean by single piece and two piece? So in general, in general, when we look at the implant, this is the implant, and then you have a abutment on top of it, and then you have a crown on top of it. So the implant part is technically called the fixture, and then you have the abutment, which is screwed in. So if it's like the implant fixture and the abutment are separate, it's called a two-piece implant. And if the implant as well as the abutment is fused with each other, we call it single piece implants. I hope this much is basic and it's clear even to the newcomers. Okay, so single piece implants and two piece implants. So R-line implant series is divided into single piece implants and two piece implants. Am I audible to all? Just a quick thumbs up, please. I hope I'm audible. And this system now is further subdivided into single piece, now is further subdivided into cement retained and screw retained implants. So when we talk about cement retained implants, we are talking about single piece smooth surface implants, which are called as the BCS or bicortical screws, and the single piece, as you see here, the implant and the abutment are one piece. They are the compressive or KOS implants, and the prosthesis will be cemented on it. So these are single piece R-line single piece implants, BCS, KOS, and the prosthesis will be cemented on it. And we also have the single piece screw retained prosthesis provision, wherein the implants have a multi-unit head. So as you see here, the KOS and the BCS, they have a head of multi-unit. So this one here is your KOS implant, and this one here is your BCS implant, smooth surface, rough surface, screw retained options. So everything is in single piece. So as you see here, all these implants are in single piece. This is cement retained and that is screw retained. I hope it is clear for all of you. So the BCS single piece cementable and the BCS MU screw retained. KOS cementables, KOS screw retained. Everyone clear so far? Just put up clear very quickly in the comment box. So far clear? Now let me demonstrate to you the surgical kit and how exactly to use this surgical kit. And once you understand all the kits, I will be giving a lot of live demos today, which will be useful for all of you to start applying this system very soon. So let me just start showing you the surgical kit. So I hope all of you are able to see this surgical kit over here. Is this clear to all of you? Just let me know if the surgical kit is clear to all of you. Can you just put up in the chat box of the Zoom link if it is clear? Because I'm using my hand phone to show you the surgical kit. So if it is clear to all of you, just let me know. Now, a lot of you people already have the surgical kit, but as I've already informed before, we will keep improving, improvising each day, every day. So the kit has been now modified into a much better design system kit, completely autoclavable box. Okay. And as you open the box, you see this implants, wherein you will see the conical drills and the twist drills. The conical drill diameter 1.8, long and short, which means this is a 30 mm and this is 20 mm conical drill. So 1.8 mm conical drill, long and short. Long is 30 mm, this is 20 mm. Clear so far, all of you? 20 mm, 30 mm, 1.8 mm is the diameter. The next is the conical, which means they are sharp drills, but diameter 2.6. Again, available as long and short. Clear so far? If everyone can just let me quickly know if this is clear so far, because now things will start getting more complex as we move ahead. So I hope it's clear so far. Can everyone just put up clear quickly, please? Yes, perfect. Thank you. Next, we have the series of twist drills as you have written over, as it is written over here. So length of the drills, Dr. Fazil, is 20 mm and 30 mm. 20 mm and 30 mm is the length of the drills. Next, as you see here, is the twist drill, which is long and short. So twist drill 2.0 and twist drill 2.6. So as you see here, once again, to make it very easy, 1.8 conical drill, 2.6 conical drill, 2 millimeter twist drill, 2.6 millimeter twist drill, and long and short. So long one is 30 mm, just like your endo files, your 21 mm file and 25 mm file. Similarly, the long and short is, these are the long ones, and this is the short one, 20 mm and 30 mm, 2 millimeter, 2.6 millimeter. I hope this is now crystal clear to all of you. Next, as we go in this kit, we have the bone expansion screws, 3 millimeter expansion screw, 3.5 millimeter expansion screw, 20 mm and 30 mm, long and short. So these are the bone expansion screws. Okay, bone expansion screws, which can be ratcheted into the mouth. And these are the drivers for the implant. So when you want to ratchet the implant in, so if out is written, you're ratcheting the implant out, and if in is written, you're ratcheting the implant into the mouth. So what you need to do now, there are two sets of, if you see here, there are two sets of ratchet drivers over here. You can just displace this driver, pick up the driver for the implant and load it. And the other one is for your bone expansion screw. So if I want to use the bone expansion screw, I can remove this adapter over here from here, put up the adapter for the bone expansion screw and load that. So depending upon your requirement, the same torque ratchet can be used for your expansion screw as well as for your implants. So again, I will put up the one for the implant, and this is now for the implant driver. So you can ratchet your implant with this. Okay, if I want to switch to the expansion screw, I switch. You can see this switch over here. I just pull it back. I just pull it back and I switch to the bone expansion screw. I hope this is clear to all of you how to load and unload the expansion screw and the implant driver as per the requirement. Is this clear to all? Can we move ahead?
Yes.
Can we all move ahead, please? Just let me know if we can move ahead. So you got the, also you have a millimeter scale over here. Any doubt, you can always pick up a drill and use the millimeter scale. Simple kit, I will show you how you can do multiple things in almost all kinds of cases. This kit can be now picked up and you will find a depth gauge and a driver. So this hand grips, you can keep it over here while autoclaving. And keep the hand grip over here and autoclave it. And if you have a depth gauge or anything like that or any other instruments, you can autoclave them also along with it. So that's regarding the small, simple yet precise and powerful surgical kit. Next, we have the drivers. Next, we have the drivers. So this is the hand grip. This is the hand grip for the BCS single piece and KOS single piece implants, cementable. Let's come closer, please. Okay. Next, you have the driver for the multi-unit. So as you see here, this driver, it has a small star inside over here. That's for your multi-unit implant. So your multi-unit implant will sit in it. The cementable sits into this. Okay. So depending on your preference, you can use either depending on your preference, you can use either. Am I audible to all? Am I audible to all of you?
Yes, sir.
Yeah, okay, great. So depending on your preference, you can use, and I will show you all this in the live demo also. You can use either the driver and the ratchet or your hand grips to place these single piece implants. So quickly to revise one more time, these single piece implants, they are divided into, and those of you are attending, all of you will get today's presentation for revision. So the entire presentation I'm going to provide to you for revision, including the PPTX also. So the entire video as well as PPTX, all of you will get it. So you did not worry, you don't need to take any screenshots or try and do anything, just focus, and I think things will get crystal clear today itself. So now just to revise, summarize one more time, we are talking about the single piece R-line implant system. In the single piece R-line system, there are two options, cementable and screw retained. The kit remains the same, only the drivers, the hand driver and the ratchet driver changes. Is this clear to all of you? Can I proceed? Can quickly everyone just confirm I can proceed, please?
Yes, sir.
Perfect. Perfect. Next we come to our two-piece implants. Two-piece implants are divided into two kinds of attachments. So when this implant and the abutment, so this is the implant and the abutment is connecting onto it, this connection is divided into two different designs. One of the connection is hexagonal, so it's called a hex connection, and the other is conical connection. The hex design has two different type of implants in it. The hex design has two different types of implants in it. They are called the DSI, dental spiral implant, and the CIH. Now, what is the difference between the DSI and the CIH implants? Let me just quickly show you. Let me quickly now show you the DSI. Is everyone able to see my screen again? Just focus as close as possible over here. So if you see here carefully now, both these implants have an internal hex connection. Hex connection. But if you look at the design, so this one is the conical internal hex connection or CIH implant. Let's go closer. Is everyone able to appreciate the conical connection now?
Sir, unable to see actually.
Okay, let me try and focus better. Just give me a minute, please. Now is everyone able to see the conical connection better?
No, sir.
Is it clear now?
No, sir.
See this one. See where the pencil is. Focus on the screen which we are focusing on. Can you see this conical implant? Now is it seen?
No, sir.
Difficult to make everyone audible. So if you can just put up in the chat box if it is seen. See this. Nice and clear. Conical implant. Is it clear now? Can we quickly type a yes for me so I can proceed? So this
No,
is
sir.
called as
No,
the
sir.
conical internal hex. And the other one, I think they're saying not visible.
Not seen, sir.
Just let me check. Let me check. I will check it one more time. Now can you see the screen now? It's not a blank screen.
Yes,
I think
sir.
you have got
Yes,
the wrong
yes.
window opened up. Can you see now?
Yes, yes, sir.
Okay. Is everyone able to see now? The conical one and the flat end one.
Yes,
So this is the conical internal hex or CIH, and this is the dental spiral implant or DSI. Is everyone able to appreciate? Quickly, can you please put up a yes in the chat box of Zoom? Perfect, perfect. And as you see here, these are all internal hex. All internal hex. It's all internal hex. Can you see now? Great. So now for your so now are you able to understand? Are you able to understand, Dr. Meena Khambe, madam, you saw it or you did not see it? You want me to show it again? Let me quickly just show on this screen also. This is the conical one. You can see the sharp conical tip of the implant CIH, and you can see the blunt tip and a more flatter design. This is the DSI. Can you appreciate now both of them, DSI and CIH? I hope at least now it is very much visible. So the brochure of this DSI and CIH implant, my team is sharing right now in our inner circle group. But everyone is clear. This is called, now a question for all of you. Which implant is this? Quickly, give a detailed description of this implant. For all those who are paying attention, I want all of you to participate, try and be interactive. Perfect, perfect, Dr. Kumar. This is the CIH implant, conical internal hex. As you see, it's like a cone. It's sharp and conical. And it's a two-piece implant. Is it clear to all of you? Perfect. The hexagon is the internal connection. See, internally, it has a hex connection, which means all these implants are compatible to all your Israeli systems, like your Edin, Norris, Bioline. If any of these users want to try this system, it is compatible. You need not buy any drivers or anything. It's compatible. So both your CSI, both your DSI and your CH implants, both are compatible with all the available Israeli system, which means that your Edin, Norris, Bioline and all these similar systems, it is absolutely compatible. I hope it is clear to all of you. Is this clear to all? Now, can any one of you identify which implant is this? Can any one of you identify which implant is this?
MU Basal.
Be more descriptive. Multi-unit, yes, but it's a MU, single piece BCS MU. If you see, it's a smooth surface. The shaft is completely smooth. Perfect. MU Basal. Perfect. And if you see here, this is the MU QS. This is the MU QS. Can you see all of you? I hope everyone is now clear, crystal clear. If everyone is clear with this, just type CC, crystal clear in the comment box. So we can start moving ahead now. Perfect, perfect, great. CSI conical internal system is compatible with your dentium and ostem. So all your ostem and dentium users, you can procure CSI. So here I'm just writing compatible with ostem, dentium. And here this one is compatible with Aidin, Norris, Bioline, and any other Israel or internal hex system. Fine. I hope all your doubts are cleared with this today. Perfect. Amazing. So far enjoying, right? I hope things are becoming now very clear for all of you today. Now let us come to the drilling protocol of Let us come to the drilling protocol. Let me just delete all these drawings and move ahead. So when it comes to the drilling protocol, now this one, if you want, all of you, I'm also putting a screenshot of this in our inner circle. If any one of you okay, then share the screenshot, so no need to remember. Dr. Sachin Gupta, there is no issue as such with the root analogs. If you have any trouble using it as a newcomer, you can definitely let me know and I will be happy to solve your queries. That's the reason I take all these efforts of giving this free webinars, almost every week, 2 hours. I don't think anyone else is giving such kind of free webinars. I'm here to help all of you. So if you find any trouble or any problem as a newcomer using it, you're welcome to get in touch with me. I'm more than happy to help all of you. So let's come to the drilling protocol of cement retained single piece implants. I think the slide is self-explanatory. So for the maxilla, we use only the when it's a 3.6 millimeter implant, we use only the 1.8 mm drill in the maxilla. In the mandible, being a dense bone, you require two drills, which is the pilot drill and the twist drill. For higher diameters, which is 4.5 and higher, you will obviously require one more drill, which is the 2.6 millimeter drill. So the experts, if you are an expert, you can directly use the 1.8 mm drill and the 2.6 mm drill directly with and skip the 2.0 drill. Now this I'm going to give you a live demo right now. So all those who are just thinking what to do, you need not worry. Immediately it will get cleared. So just hold on and I will show you. Just give me a minute and I will show you what we exactly mean by this. Now, is everyone able to hear me now? So this is the maxilla. Can everyone see this? This is the maxilla. So we use the only drill required for the in the maxilla is your 1.8 mm drill. That's it. The only drill which is required in the maxilla is your first drill, which is the 1.8 mm drill. So this drill in the maxilla, that's it. For all your 3.6 millimeter implants, you can use only this drill everywhere in the maxilla. And for the mandible, you will require the pilot drill. You will require the pilot drill, which is the 1.8 mm drill, and the twist drill, which is the 2.0 drill. That's it. So maxilla is a 1 drill protocol, mandible is a 2 drill protocol. And as you go higher in terms of diameter, you may require more number of drills. But in general, all your cases in maxilla, you can finish with 1 drill. In mandible, you can finish with pilot drill and twist drill. And that is true for both your KOS as well as your BCS implants. So my maxilla, pilot drill and implant, mandible, pilot drill, twist drill and implants. Very simple. And all of you, as you go higher in the diameter of the implant you're using, you may require more drills, which we have already explained. You've taken the screenshot also. I hope so far things are clear to all of you. Yes, even for pterygoid, only 1 drill always. Dr. Meena madam, yes, screen is becoming on and off because I'm using 2 cameras. One camera is focused to me and the other camera is focused on the equipment. So depending upon what we are talking, the one camera has to go off and the other has to go on. Dr. Ajit, you have got it. Is anyone in this room having any query so far? In terms of drilling protocol, very simple. Maxilla 1.8 mm drill and the implant. Mandible 2 drills, pilot drill and twist drill and the implant. That's it. As you go higher in the diameter of the implant selection, which is 4.5 and higher, you may require a 2 and a 2.6 millimeter drill. As simple as this. Cannot get simpler. Depending on your preference, either you will place the implant with the hand grip or you will place it with the driver and ratchet, which is shown. Is this clear to all of you so far? Can we proceed? If yes, just put up proceed and we can move ahead. Is it clear to all? Any doubt so far? Please let me know. Screen is visible? Yeah. Presentation. So already I told you about the drilling protocol of cement retained implants. Now, when it comes to the KOS or compressive implants, the drilling protocol becomes even easier. So forget maxilla and mandible, just think in terms of a KOS implant is the implant which you use to compress the cancellous bone, and you are literally making a smaller osteotomy to place a wider diameter of implants. Now, those of you who have attended all the inner circle sessions, you will be able to connect the dots better. The principle of action, KOS, all this we have already discussed in depth. Now you can connect better. So if you have if you place a 1.8 mm drill and the bone quality is soft, but you want to place a compressive implant because there is enough volume of bone, then you use a 4.0 KOS. If while drilling, you find that the bone quality is very dense or hard, use a 3.75 KOS. Very simple. So during the time of operation, depending on the 4th dimension, which is the quality of bone, we are determining the diameter of implant. The length of implant is predetermined. So depending upon the height and width I am having, I make an osteotomy at the predetermined length, keeping my anatomical structures in mind. And I take care of the 4th dimension, which is the quality of bone. If the bone quality is soft, I will use a 4.0 diameter implant of the designated length. If the bone quality is hard, I will use a 3.75 implant of the designated length. Is this clear to all of you? Right? Coming to the MU implants, which is the screw retained single piece implants. Please understand, a lot of people I am seeing, they are getting very excited about these implants. Doc, how do we determine quality of the bone clinically, sir? If your hand sinks in very fast and you feel the bone is spongy, you can do it. The other technique you can do is, if you missed it, you can use the bone expansion screw. So if you make an osteotomy and you don't know what the quality of bone is, use the bone expansion screw and you try to place it in the bone. If your expansion screw goes very easily in the bone, it's just sinking in, that means the bone quality is very poor. If you are unable to screw your bone expansion screw, that means your bone quality is very hard. Please understand, this is a dynamic situation. It is not that a textbook solution for that. You have to gauge the quality of bone while drilling. And depending upon, if you are in doubt, it is always better to use the bone expansion screw, gauge the quality of bone, and then place up the implant. I hope it is clear. Now for single piece screw retained implants, I have seen that a lot of people of you are get excited, but fortunately, you don't have the complete know-how of the system. And because of that, I'm seeing that people are struggling. It's a technique sensitive job because you need to compensate for the implant as well as the multi-unit. So the best way to do it for BCS MU implants, you perforate the cortical. Let's say you perforated at 17 mm, you pick up an implant which is 2 millimeter lesser in length, 2 to 3 millimeters. So if you perforated at 17, you will pick up a BCS implant which is of 14 mm length. This is contradictory to what we normally do for cement retained. So I would say this is one step ahead, and I will advise people who have not done any basal implants to first place the regular basal implants, get the hang of cortical filling, and then migrate to the single piece screw retained option. For KOS implants, you need to select 3 millimeter lesser than the length of osteotomy, which means, in other words, if I want to place a KOS MU of 10 mm length, I need to drill till 13 mm. Why? Because the remaining 3 mm compensates for your collar of the multi-unit. The collar of the multi-unit needs to go up till the gingival level, which is not the case for cement retained prosthesis. So simply follow this rule and you will see the results. I hope this is equally clear to all of you. Just consider this as a rule and start following it, and you will find amazing results with it. Dr. Vivek is asking, can bicortical screw retained implants be used to place mandible overdenture? Yes, that is the beauty of this system, that with one kit, one system, you can create whatever type of prosthesis you want, whether you want cement retained, whether you want screw retained, whether you want to follow digital protocol, manual protocol, everything is possible. Even placing two-piece implants is possible. So that's the beauty of the system. And all the platforms are connecting with each other. How many of you, the last point, if you remember last inner circle, we discussed regarding the lesser armamentarium and increase of ROI. How many of you can now connect the dots and understand that how one simple kit can provide you all solutions, and yet you are not increasing your armamentarium? How many of you find this fantastic? Thank you, Dr. Sumit. Yeah, thank you. Now let's come to the surgical kit for the two-piece implants. Now I don't want to confuse all of you. There's nothing great about the surgical kit of two-piece implants. Is almost similar to all available systems. All you need actually is some extra drills, which I'm going to show you directly live, so there's no confusion. So just give me a minute as I remove my laptop over here, and we now go to the surgical demonstration of all the implants along with the discussion of welding. Okay, so let me just quickly start placing all the implants for you in a live demo, and let's see how it all goes. Just give me a minute to switch the cameras.
Yes.
Dr. Sen is asking, sir, what about advantages of welding? Is there a standard BCS QoS? I see advantages, disadvantages, all that we will come to. Right now, I request you try and focus on what we are telling you rather than creating more queries in your mind. At least try to absorb what is being discussed, and then later on we can discuss more things if there are any queries. So let me now show you the live demo. Okay. So as far as the handpieces are concerned, I use the handpieces from Teresa Enterprise. So all those who are not aware about Teresa Enterprise, I will just put up the number of Teresa Enterprise in the chat box, 93215 That's Teresa Enterprise. So for people who want to procure anything, handpieces, kit, implants, anything, please get in touch on that number. So as you see, these are very nice handpieces. Also for your conventional implant, you require the 20:1 handpiece from Teresa Enterprise. You can use any other available handpiece in the market, WNH, Kao. But the problem is what I've seen is they are very expensive. Like a WNH handpiece, a straight one will cost you not less than 45,000. Straight handpiece for the upper jaw, 1:1 contraangle handpiece for the lower jaw, and a 20:1 handpiece for your conventional implants, two-piece implants. So this is how the distribution of handpieces will go. In terms of kit, for this single piece, you require this one simplified kit from R-Line Implants, again available with Teresa Enterprise. In terms of drills, for single piece implants, I've already explained you. If any one of you wants to do the two-piece implants, all you need is some few extra drills, which means you have the 1.8 marking drill, you have your 2 mm drill, you have your 2.6 mm drill. All you will require is a 2.8 mm drill and a 3.2 drills. A person who has this kit need to buy a 2.8 mm drill and a 3.2 mm drill. For your implant driver, for people who are using the two-piece implants, you will require a fixture driver, which is available like this. For people who want to place the implant with the hand, the two-piece implant with the hand, you require a T driver, which fits into the CIH implants. Please fit and show it. Which will fit into the CIH. Hold this, please. Okay, can you check on the okay? So this is how the drilling protocols we are discussing now. I hope everyone is so far clear that how with the very limited armamentarium we are doing everything. Is it clear to all of you? With just this kit, my entire implantology is over. Just imagine my armamentarium. That's it. This is it. 3 hand pieces, drills, couple of hand grips, couple of extra drills, and I am done. Can you understand how simplified this armamentarium is to do any case and every case? Are you getting the beauty of the system? Perfect, perfect. So let's move ahead with the live demonstration. So regarding the live demonstration, also I want to explain to all of you the physio dispenser from Teresa Enterprise. So normally when you take a WNH physio dispenser or a woodpecker physio dispenser, they will cost you anywhere between 90,000 to 1.5 lakh rupees depending upon the model you select. This one over here is around 60,000 rupees. So value for money physio dispenser, completely digital physio dispenser. Now the beauty of this physio dispenser, it has a auto sense technology. Now what I mean by this technology is, if you see here, right now the physio dispenser speed is 1000. If I place, just hold this please. If I place the 1:1 handpiece in the physio dispenser, it has recognized that this is a 1:1 handpiece and it will start revolving 1000 RPM. Now, without changing anything, if I remove this handpiece and if I put a 20:1 hand, if I put a 20:1 handpiece, if I put a 20:1 handpiece, mind you, I have not changed any of the settings over here. It will revolve now 1000 divided by 20, which is 50. So this is at 50 RPM. So this is the beauty of the auto sense tech. So this is the beauty of the auto sense technology, where without doing any changes in the handpiece or in any of the settings, the physio dispenser is set auto sensing that which handpiece you are putting. Coming to the other digital modes, there are all the digital modes here, which I'm not going to go in detail right now. And you can also control the torque and the speed. So it's completely customizable. And now let me get to the live demo. Now BCS and QS implants, I have seen almost everyone knows how to place it. But still, for the sake of demonstration, let me place one. Is it clear? Can I continue? So I take my conical drill in the maxilla. All I need is my conical drill. Speed just increase, please. Right now I'm keeping the saline off because obviously we don't want a water over here. But in general, in the mouth, we use with the saline. Just start the machine, please. Start the machine, please. Okay. Yes, okay. For the basal implants, as mentioned to you, we use the 1:1 handpiece. So 1:1 handpiece. Just start the machine, please. For the mandible, I use the contraangle. For the maxilla, I use the straight handpiece. So right now, I have attached the contraangle for the mandible. I'm doing a lingual cortical engagement. That's it. And as you see here, my drill has perforated the opposing cortical over here. Okay. Now, as the protocol says, we need to switch to the twist drill. So I will switch to the twist drill and again go till my full working length. As you see here, I have perforated the opposing cortical. Okay. Once the opposing cortical is perforated, I will take my hand grip. And I will place the smooth surface BCS implant, engaging the opposing cortical. So this I can do with my hand grip, or alternatively, if I want, I can even use my driver and ratchet to ratchet it. So either I can use my driver and ratchet. I can use my driver. So when the in is written over here, that means it is going in. So either I can driver and ratchet it in, or I can use my hand grip to place the implant in. And this is how you need your lingual cortical engagement. Obviously, the length, I have just selected any random length, but in the mouth, you will select the exact length. and you will get the perfect placement. So this is regarding your BCS implant in the mandible. If you want to place a KOS implant, you will only drill with the pilot drill. Only drill with the pilot drill. Please. You will go in up to the predetermined length. That's it. Now, if you find the bone quality is dense, you select the 3.75 implant. If you find the bone quality is soft, you select the 4.0 implant. It's as simple as this. Drilling protocol remains the same. Sometimes in the mandible, as I mentioned to you, bone is really hard. You will require the pilot drill as well as the twist drill. So in the mandible, you remember the drilling protocol as pilot drill and twist. I hope this is clear to all. Let's move to the maxilla. So for the maxilla, I switch my handpiece to the straight handpiece from 3C Enterprise. Beautiful design. Okay. I switch it to the straight handpiece and I take the maxilla. And you can see here, nice perforated the nasal cortical. And now you will pick up your implant. You will pick up your implant, BCS implant of the final length you have achieved, and you will place it using the hand grip, or as I mentioned earlier, with the driver and ratchet. Okay, so I hope regarding the BCS implant, maxilla, single drill, QS implant, maxilla, single drill, mandible, pilot drill, and twist drill. I hope this is clear. Now, is everyone ready for the KOS and BCS MU implant? Please let me know. Just type ready in the comment box and let me know if you're ready for the KOS and BCS MU implants. Is it clear to all of you so far? And can we go ahead with the BCS and KOS MU implants? Everyone with me so far? Perfect. Great. Let's go with the KOS and BCS MU implants. So for the KOS implant, in the mandible, as informed before, you use only one drill, which is your pilot drill, up to the desired working length. I have drilled for my KOS implant here. Now, as I already mentioned, for a 10 mm implant, you need to drill 13 mm. Or if you look at it reverse, then for a 13 mm, if you drill up to 13, you have to select 10 mm. That compensates for the head of the multi-unit. Now you take up your multi-unit implant. In your multi-unit.
I could see.
And you take this up and you place your implant. Now, when you're placing the implant, make sure now here we don't have the gingiva. Here we don't have the gingiva. Your entire thread should be submerged in the bone. Your entire thread should be submerged in the bone.
Difficult in mouth movement.
Okay. All your thread should be submerged in the bone. You can even counter check it with the X-ray and make sure that if this is the gingiva, then your collar should be till the gingiva. I will just explain it to you one more time. But this is where your multi-unit ends. This part here is where your prosthesis ends. So this entire collar will go into the gingiva. Up to this entire platform till here. Go all into the gingiva. Okay. So I hope this placement of KOS MU implant, for placement of BCS, again same, drill up till the opposite cortical, minus around 2 to 3 mm and place the implants. Is again the same. Now those of you who want to understand regarding the bending about the KOS and BCS, As of now, the KOS implants, the bending is not possible in the current design. I think by December end, the R-Line is introducing another design where the KOS implant is also bendable. But as of now, the KOS MU implants are not bendable. The KOS single piece implants are 15 to 20 degrees bendable, which is more than enough. According to me, KOS implants need not be bended because you place QS implants when there is sufficient bone volume. So it doesn't make sense for you to place implant in the wrong angle and then try to correct it. So technically, actually, there is no need for bending. But those of you are very specific and you want a bendable, just wait for another month and you'll get it. For PCS MU implants, they are completely bendable. The bending video I'm going to share at the end of the session very soon. For those of you who want to know about the bending about the BCS, it's absolutely similar to the soda technique of your BCS cementable implants. Just you have to use the bending tool and bend it. And the video of it I'm going to share very soon. So this is regarding your single piece implants. But let's move ahead and place also with this same kit a two piece or a conventional implant. And similar concept, you want to engage the opposing cortical with a two piece implant. CIH is the implant for you, very economical, 2500. Packages of CIH and BCSI implant, 20 implants, 20 multi-unit, 20 cylinders, just 90,000 rupees, which is 4,500 for implant with multi-unit cylinder. I think it's the most economical in the market. Most of the companies, just the multi-unit cost 4 to 5,000 rupees. Here you will get the implant with the multi-unit with cylinder 4,500. So very economical. So those of you who want to play, you have to perforate the opposing cortical. CS implant and you place your implant engaging the opposing cortical like this. Okay, obviously this entire implant will be synced in. Right now I've just taken any arbitrary length of the implant. I've taken any arbitrary length of the implant, but in general, otherwise, this implant can be completely synced into the opposing cortical. The tip can be synced in. Similarly, if you're placing this implant in the nasal cortical, you need to perforate the opposing cortical. Okay. And you can place this implant in the opposing cortical like this. Amazing. See this. As far as the drilling protocol of CIH implant is concerned, CIH is a very aggressive implant. In most cases, you will require the pilot drill, the 2.0 twist drill, and the 2.8 mm. That's it. Especially in maxilla, it is more than enough. Pilot drill, twist drill, and 2.8 mm drill. 2.8 also sometimes just half length and your implant will go in. In the mandible, may require a 3.2 mm drill just to halfway to open up the cortical. That's it. So you'll have to be very diligent, especially when this is all for experts who want to engage the opposing cortical with these implants. When it comes to the DSI implants, it's exactly similar to your Edin Norris, where we put them straight into the axial bone. Let me show you. So let me switch to a 20:1 handpiece and show you the complete protocol of a DSI implant. For the DSI implant, I pick up my first drill, which is the pilot drill. Now just bear with me, which is the pilot drill.
Slight discomfort is okay.
I switch to a 20:1 handpiece.
I've written the time.
Just start, please. So let's say I'm placing a DSI implant in the mandible. So this will be my first drill, which is just a marking drill. Okay, next. Next, I will take up my 2.0 twist drill up till the full working length. Okay, in the mouth, obviously you're going to irrigate it. So all this work. So 2.0 drill, and next, as I mentioned to you, your 2.6 mm drill, and in some cases your 2.8
आपका
mm
तो मैं
drill.
कर ही रहा हूँ, मैं इसको कह रहा हूँ क्या हो गया।
Now here I find the bone quality is hard, which means obviously my implant is not going to go. A 3.75 implant is not going to go with a 2.8 mm drill. The trick is to keep the osteotomy 0.5 mm. That's it. So sometimes I use the 3.2 mm drill if the bone is really hard up till the full length. If the bone is hard and then cancellous bone soft, I just use the 3.2 mm drill. It's one of the cortical. Then I place my DSI implant using the same T driver. Okay.
Rohan sir.
Now here I've taken the arbitrary length of the implant. So obviously it may or may not go completely in, but this is how your DSI implant goes in the bone, just like your any other implant. Okay. Got it? So just sink in right up till the crestal level. Keep it equicrestal or 0.5 mm subcrestal and you are done. So a lot of people, last time also we were discussing and some of us were mocking. It is not that we don't know how to place conventional implants. That's why we are doing basal implants. Not like that. Depending on the case, all those who are following us in all the inner circle sessions, depending on the case, we are selecting what to do. So how many of you like this? I think I'm not sure if any of the webinars I have seen so far who have demonstrated procedures like this live. How many of you like this so far and are ready to know more about the intraoral welding and other tips and tricks related to the implant placement? Just type ready in the comment box as we set all this up. The setup for the welding, just 2-3 implants welding. Yes, CH can be loaded immediately. Definitely, it can be loaded immediately. So any implants where you get a good torque and you are able to give a good over-engineering cross-arch stabilization, you can load immediately with CIH as well as DSI implants. Right. Yes. So Dr. Mohammed is asking, can we place normal conventional implants with this kit like Ostel? Yes, 100%. But for Ostel and Cowell, you need to have a CSI kit, not a DSI and CIH kit, because as I already mentioned, Ostem is a conical design. Dr. Sumit, yes, please. Other participants, please mute yourself. Thank you, OnePlus. I'm glad it's very informative for you. Thank you, Dr. Aniket. Dr. Jollis, can CH be loaded immediately? Yes, if you get good torque, cross-arch stabilization, yes. On a scale of 10, I just want you to all rate so far how much informative have you found this session to be on a scale of 10, please. You can type 1 if it is less informative and 10 if it is very informative for all of you. Even if it doesn't go. Thank you. And one cylinder also I can show all of them. Just give one cylinder, we'll not weld it. Thank you so much, all of you. Dr. Deepak, as I mentioned, BCS you need to bend after placement. KOS MU are not bended. None of the implants are pre-bended. All the bending happens after the implant placement. Thank you, Dr. Riti, Dr. Segula, Shiraf. Thank you. We are just preparing. Meanwhile, can I, if possible, can I just a bit and get my laptop for some time? Meanwhile, so my team is preparing. Meanwhile, for the welding demo and tips and tricks on welding and a lot of other small things I want to share with all of you. Till the time they put up regarding the welding, I have a couple of more slides to show all of you. If any questions, meanwhile, thank you. Thank you all for appreciating the presentation. I'm glad that I am able to help all of you. A lot of you people have requested me last time in my personal chat to so all this demonstrations, presentations, lectures in a much more detailed format are available in the HD video library and the books. So those of you who have ordered the prosthetic books, I think a lot of you are already having the surgical book. You will definitely, I think, must be enjoying reading it. But those of you who have ordered the prosthetic book, I think it's just a matter of another 1 or maximum 2 weeks. You will start getting the deliveries for the prosthetic book also. For those who have last time taken the Diwali package for the HD video library, congratulations. You people have taken one of the best decision in your life. Unfortunately missed by many, wherein in the HD video library, we see a lot of live video presentations and also case presentations and my surgeries where I'm explaining like this on the patients, which will really help you all make better decisions and better thought process when you're treating on your cases. Regarding HD library or any of the other things I've mentioned, if you have any queries, please connect with Trisa Enterprise, which is 9321533493. Yes, Dr. Subodh, the HD library gets automatically updated. Those of you are interested to get more videos, you just need to keep upgrading like your Netflix subscription or something like that. A couple of more slides which I wanted to share with all of you. Yes, all basal MU are weldable as well as bendable. Very good doubt. Thank you for asking. Now, how many of you till the time these preparations are on want one super value add-on tip? You know, I asked all of you in the inner circle session, what if I give you one tip where you can have one extra assistant in your clinic working for you free of cost? How many of you want the answer for that question? Type I. Type me or type I want the answer. Type me. Let me tell you, just get the integrate tablets. Let me give you one amazing piece of practice management tip as always. So all our patients who undergo implants, all our perio cases, all the patient with TM joint problem, any kind of bone diseases, any patient, see how many of you now before I answer, how many of you in this group take any one kind of medicine? It could be a multivitamin, it could be a health supplement, it could just be a tonic. In your family, if you feel, how many of you take some kind of health supplement daily? It could be vitamin B, vitamin D, anything. Just type yes if you are taking some multivitamin daily. I think almost all of us, either me, our family members. Now, what happens is, as patients, lot of our patients keep asking, what medicine can I take to further supplement the hygiene of my teeth or oral care? About the bone, because all of us know that the biggest or So for all your diabetes patients, all your TM joint patients, all those who want a overall good healthcare, I prescribe to them this integrate tablets. I prescribe to them this integrate tablets. They are called tablet integrate. Okay. These are the integrate tablets. One tablet daily for 30 days, and they can go as long as 3 months. The cost of these tablets is 1200 rupees to the patient. For the doctor, it is 700 rupees. And you can obviously buy it from 3C Enterprise if you wish to try. I personally consume it. Now, why I consume it is, it contains Cissus quadrangularis, vitamin somnifera. Now, these are also mood enhancers. So I don't want to get detailed into it, but all your ashwagandha, your vitamin K, vitamin D3, vitamin K2, zinc, magnesium, calcium citrate, everything related to your mineralization cycle, everything related to your, even after your difficult third molar extractions, total extraction, you will not believe the kind of healing you will get. It's just like magical. It's just because ashwagandha, as we all know, is an Ayurvedic steroid. So we don't want to keep prescribe steroids to our patient. Also, there's a lot of mood enhancing effect. I've seen the patients are much more calmer. They don't get swelling. And more importantly, you earn 500 rupees out of every prescription. Now, if, for example, you are treating 10 patients daily and you start prescribing just one packet every day to just one packet, TM joint patients, pyorrhea patients, implant patients who want a long-term sustainability, all these patients, any patients who want to maintain that good bone health, this is the tablet for you, integrate tablets. It comes as a pack of 30. MRP is 1200 rupees. For the doctor, it is 700 rupees. 500 rupees straight away you get for writing the prescription, dispensing it from your operatory, which is good for all of you. If you end up placing just one prescription daily, straight away 15,000 rupees, you get a free dental assistant. How many of you found this as an amazing value-added tip and you have never thought about this? Please let me know in the comment box. You can put up. So I've asked one of my team members to put up the video, which I've already put up on the social media, to put up in the group. And thank you, Dr. Sumit. So these are all, sometimes we stop, we always look at the big picture. We miss out these small points, but it's by drop you will make up the ocean. So don't miss out on all these small points. I'm putting up the integrate tablet picture. All my course participants, they are already prescribing. They have found so much of value to their patients. And apart from the value, the practice management tip, which I mentioned, you can just think about it in whichever way you want it. And it's really mind-blowing how you can change the quality of your healing, the mood of the patient with one simple tablet, which is a unique composition of Ayurvedic and allopathic components. So let's get back to welding now, which is the main topic of discussion today. So before I give you the welding demo, let me just quickly show you. So now for every one of you, can you identify in the screen which is this implant, the one in red? Can you identify which is the implant in red? CIH, perfect. Conical internal hex, CIH implant, perfect. And can you identify this implant which is next to it over here in the box? This one. Can you identify the implant? DSI, perfect. Dr. Suprita, thank you. Conventional, Dr. Vivek Gupta, perfect. DSI, two-piece implants with internal legs. Perfect. I'm so glad all of you have absorbed this and got it. Really, I'm feeling happy that this session is become successful and all of you have been able to absorb it. Now, let's quickly come to the next part of our presentation, which is related to the intraoral welding. So now, what is the, so all this regarding the drilling protocols and all, you need not worry. This entire presentation I will make available in the video, as well as my PPT also I will be circulating in the group for anyone who wants to go through it again. So you need not worry. And let us come to the intraoral welding. Now, one of the biggest advantage of intraoral welding is ability to temporize with single piece implants. Now, a lot of people are worried about retrievability. That is also possible with single piece. When you do the welding, you can create click-on dentures. Those videos are also put up in the HD video library. Those who have already procured the HD video library, I'm sure you will enjoy it, watching it, and how easy it is to create click-on dentures when you do the intraoral welding. Some cases, especially as beginners, when you're riding a bicycle, you want that extra 2 wheels so that you don't fall down. So I consider this as the extra support for people who don't get good torque or beginners. It's like a float when you're swimming. So even though you've not got good torque, I have seen cases which have succeeded simply because of the intraoral welding. The most amazing part, according to me, is the cost benefit. Because when you do an intraoral welding with this kind of a wire, all you're spending is this 400 rupees, I think. With Risa Enterprise, the cost of wire is also very economical. In the market, it is available for 500 plus GST, which is roughly 600 rupees. But with Risa Enterprise, if I'm not mistaken, it's roughly 380 or 290. Okay, perfect. It's just 290 rupees. So just 300 rupees, no need for framework. So when you give any prosthetics to the lab person with a metal frame and all, they charge you 12 to 14,000 per arch. So the upper lower arch is roughly 28 to 30,000 depending upon the lab you're using. Here, this 300 plus 300, 600 rupees, you can even create PMMA prosthesis, acrylic prosthesis, and GCAM prosthesis. Amazing results, lighter prosthesis, and you don't require any frameworks. Your cost comes down to nearly 50%. If you make acrylic prosthesis, mind you, you can give the upper lower prosthesis to the patient in 6,000 rupees. Unbeatable pricing. In India, it's all about economics. And if you don't know these tips and tricks, you're never going to win the game. You may be the best clinician in India, but if you don't know how to control your commercial aspects, you will never be able to win the game. That is why always I focus on the economical aspects also in my presentation. How many of you feel that an intraoral welder, if you have in your practice, will bring down the cost factor of your prosthesis by more than 60%? How many of you agree to this statement? Just type agree in the comment box. Thank you. Thank you everyone for agreeing. And are you ready to see now a live demonstration? Now, the beauty of this live demonstration is that we are going to weld with the same welder, same settings, the basal implant single piece, QoS implant single piece, MU implant single piece, 2-piece implants, all welded with the same setting, same welder. Which means that if you're using the R-line implant system, for some reason, you have placed 2-3 conventional implants here. Next of the case you're doing with basal, there is interconnectivity. If you are placing the BCS the beauty of the system is it allows you to switch wherever you want, whatever you want to do. How many of you find this concept amazing and never heard of? And are you ready to now witness the intraoral welder? Now, before I talk to you about the welder, let me share also the pricing. All the commercial available welders, all the commercial available welders in the market cost anywhere between 2,25,000 to 2,80,000 rupees. 2,25,000 to 2,80,000 rupees. if the software goes wrong after the warranty period, just for getting the software reloaded, you will end up spending 25 to 40,000 rupees, which no one mentions to you while selling the welder. But with Teresa Enterprise, as economics always plays an important role in India, we have launched one of the most amazing welders at an amazing price of 1,50,000 rupees. But for all those doctors who are pre-booking it, because we've achieved a lots of bookings already, and we are going to start, dispensing this wonderful welder, the amazing scheme only for today. Mind you, only for today, before the webinar ends, we are sending the bank account details. Anyone who wants to pre-book this welder, only for today, the pricing will be 1,23,000 rupees. That is inclusive of the GST. Am I correct, Dr. Jetali? Yeah. Courier charges are included. And we are also bearing the courier charges. Just mind you, just couriering this equipment, which is 8,9 1,23,000 GST is inclusive in this price, is the welder price only for today, for the next 10-15 minutes, probably till this webinar is going on. Already we are sharing the screenshot, we are sharing our blank details. Those who are interested, please pay before the webinar ends and send a screenshot in the group to confirm your welder. After this webinar, immediately the prices will be 1,50,000 rupees. Okay, so this is a value add I'm giving to all of you. Just grab it and you will never regret the decision. And now let me show you the live demo of the intraoral welder, which you are all going to grab very soon. The pricing, my friends, again to repeat, is exclusive only till the end of this webinar. Please don't ask for this pricing after the webinar. This is for people who make the decision immediately and are able to take up a call right now. And already the bank details are shared. And now let me quickly share the video of the welder. Right. So let me show you now this welder, which I'm showing you right now is a prototype, which means it is not the exact model. The exact model we will be soon sharing with those people who have done the booking, but let me show you the functioning. It is a manual control. It is a manual control like your digital analog. So as you see here, this is the manual control where you can manually change the settings over here. Okay, you can manually change the setting over here. And now this welder is ready to go. So I have Dr. Chaitali with me, who is going to do the welding for us. And as you see over here, just one person, please help her out. As you see over here on this medal, we have the BCS implant, we have the KOS implant, we have the single piece implant with the abutment, and which is hollow. So the another beauty of this welder is you can weld the hollow abutment as well as you can weld the regular, and we have a multi-unit implant with a titanium cylinder. All of this we will be able to weld. Right now for demonstration purpose, you can just weld this two and I think everything is done because one is solid, one is hollow. Yeah. Okay. So whenever we are welding, your assistant is putting the water on the welder and your assistant is sucking away the welder, which the water, which we are not doing right now. There is a possibility of a small spark which can happen in any welder. You need not worry. This spark is not going to burn you. That's when the electric current is passing through the air. Sometimes there's a spark. You did not worry at all. Right now, you may even see fumes happening because we are not putting any water control on it. Okay. But let me quickly still show you without any water irrigation how smoothly this welder works. Just hold on, please. Whichever you're comfortable, no problem. Whichever is comfortable. Is everyone able to see? So this is the welder which is clamped. Just hold on, don't weld, just clamp it. Just clamp it and keep it ready for welding. So as you see here, this is a very nice adaptable welder. Clamps very easily, single-handed. So in spite of, some welders I've seen, they are very heavy. And then all she needs to do is press the foot pedal. And the moment the foot pedal is pressed, which is pressed right now, done. Can you see the small smoke and the welding is done? That's it. As simple as that. Can you weld the next one, please? You can see without changing the setting, we are and just press it, please. You in the solid as well as the hollow abutment, both done together. Both done together in the same setting. How many of you found this absolutely amazing, where without changing the setting in a hollow abutment as well as in a solid abutment, the welder has worked absolutely no spark in spite of not throwing a water irrigation? How many of you found this amazing value for money product? Meena madam, right now just for demonstration purpose we have welded. It is simply for your demonstration purpose we have welded them together. There is, so in case there is a situation where you have placed a couple of conventional implants, or for some reason you have done 2-3 delayed loading implants. Now the patient wants immediate loading. You want to connect all of them. Also, it's possible. So you are able to connect conventional to basal, basal to MU, weld them together, change the system the way you want. I'm showing you the versatility of the system. How many of you can appreciate the versatility in the system which I'm showing you along with the economical factors? Thank you, Dr. Sumit, for putting a VFM, value for money. And before I take up the next questions, I just want all of you, whoever have booked the welder, to let us know as soon as possible, because the moment we wind up, for those who want to know more about the welder, I am giving the number of Trisa Enterprise 93215-33493. That is Trisa Enterprise number. Mind you, if you book today, yes, you can place the wire buckle also, no problem. So for a lot of class 3 patients, I have placed the wire buckle to create a labial profile, which this case has been already put up in the textbook also, madam. I'm sure you might have read it. So all these things now you can start connecting the dots. For those of you who want more information about integrate tablets, HD video library, or the welder, please connect with Trisa Enterprise. Is welding possible for any other conventional? Yes, it is absolutely possible. That's the beauty of the welder from Trisa Enterprise, almost $1.5 lakh lesser than the commercially available welders. And the wire is also less than, I think, around 300 rupees. All the commercially available wires, titanium wires, are close to 550-600 rupees. So that's 50% off. Sir, obviously you can never, why would you weld on the multi-unit? Because if you want to weld on the multi-unit, you can weld on the shaft. But there's no point on welding at the multi-unit abutment, because that's where your screw is going to come. So either you weld on the cylinder or on the shaft, wherever you want to, but I prefer on the cylinder in case if it is. So what you can do is you can place your cylinders, weld all of them, cement your prosthesis, and then when you remove the screws, you'll have a retrieval prosthesis without actually creating a retrieval prosthesis. Dr. Chaitan, right now for pre-booking, immediately you can just pay 10,000 rupees and get in touch with Dr. Chaitali later on, and she will guide you. Just get in touch, because please don't involve me in all these things. How much they need to pay for pre-booking? 50,000. I'm sorry, but right now, because you're in the middle of a webinar, you want to take up the scheme, you can just make a small amount and then get in touch with any of the members on Trisa Enterprise. For HD video library, some of the people are requesting me again, so we are just repeating the scheme. Dr. Chaitali, can you repeat the scheme like given last time to everyone?
Book both the books, HD video and online masterclass 16,000.
So only for today, again, because of the multiple requests we are getting, this is the last time. Both the books, can you please repeat? HD video library.
Online masterclass.
HD video library is the entire library of all the videos we have across the past 4 years. You can go through, and the online masterclass where such detailed lectures are there. The cost of everything is coming up to 25,000 rupees, and only strictly for the next 10 odd minutes till the webinar is on, it will be 16,000 rupees. So this is for people who are really interested. You can grab this scheme immediately on the same bank details. You can transfer 16,000 rupees. Not the same bank details. Okay. So just get in touch with, just get in touch with Teresa Enterprise for this scheme also if you're interested, and they will help you out with the bank details. I don't want to confuse all of you over here, but from my end, I am giving you all the information, all the schemes, and just get in touch with Teresa Enterprise, whoever is interested. Now let us get back to the medical part where I can help you further. How do we retrieve it after cementing it? So, Dr. Ajit, once you see the idea of creating a rigid framework and cementing it with permanent is there is no movement in the implants. But the moment you have a welded situation, you can even put your prosthesis in temporary cement. So it's very easy to remove. And tomorrow, if possible, in my clinical hours, I will put up a video on the inner circle, how I'm retrieving my prosthesis. Is like less than a minute's job. You just have to use your crown remover. You have a temporary cement and you click it off. So that's, in fact, nowadays with the CAD/CAM scanning and all, most of the prosthesis, they just click in. So we are doing a lot of prosthesis which fit superb to the patient, but no screw, no cement. So we have regarding integrate tablets and in our inner circle group about the advantages of integrate tablets. Commercial aspect we have already discussed, and the clinical aspects I'm putting up a video. Now, like every time, I want to know from all of you the 3 important points you have learned from today. You can put it up on our WhatsApp group, please. And there's one last final tip which I want to give all of you before we depart for today. But before that, I just want quickly to know from all of you. And once the webinar ends, we will be closing. I will keep for the sake of, so that we don't create stress, probably another 1 hour. If any one of you wants the welder, get in touch with Teresa Enterprise for this amazing scheme. Mind you, we have record number of order from colleges and from institution and from individual doctors. So in case if you book today, the earliest possible you get the welder will be after 45 days. That is the amount of bookings we have. So in case you're interested at this particular pricing, you can book it immediately. You book today, you take 45 days to get it in the pre-launch offer. Once our orders get normalized, we will be raising the price to 1,50,000 rupees. Now, before we go on further, I just want to quickly know from all of you, what were your 3 key learnings? How I can impart you something much more valuable next time. So quickly, please, given you 1 hour to all of you, just let me know your 3 key learnings for today, please. So welder price and offer, a lot of people you're asking. I just request you get in touch with Teresa Enterprise. 9321533493 for the welder. Let's not clog this group regarding the welder. Let's restrict ourselves to the medical part. And please connect, those of you who are interested, just connect with Teresa Enterprise for the HD video library scheme, welder scheme, and any other things, integrate tablet also. If you want to purchase, just club all of it together. Thank you, Dr. Aniket. Versatility, value for money. Thank you. Thank you for mentioning this. If there are any further queries also from any one of you, you can definitely let me know. And I'm there to help you in the journey. We have our upcoming course in December. So if any one of you is interested in the learning course, you can definitely let me know. Tablet details I have mentioned in the video. Just go through the video and you will get to know all the components of the integrated tablet. And in case any one of you wants it, MRP 1200, for the doctors it's 700 rupees. 500 rupees you can just earn by casually talking to the patient every time they come to you for a repeat follow-up. I just insist they take these tablets and I don't charge them for the consultation. It just works wonderfully well for me. Thank you, Dr. Sumit. Thank you. Thank you for mentioning about the versatility. And because now I think we are almost at the fag end of whatever we went to discuss. But for people who want to make a decision regarding welder, we will keep the offer on till 7:30 today. Integrate tablets, HD video library offer also till 7:30 today. Integrate tablets, the price is same. Anytime you want to buy, whether you want to buy today, later on, don't hurry into integrate tablets. Need not worry. But for welder specifically and for the HD video library combo offer with the 2 textbooks and online lecture, you can grab it today at this price of 16,000 rupees. So with this, thank you, Dr. Sachin, for appreciating the R-line and the integrated tablets and the pro tip, Dr. Fazil. With this, I sign off for today, and I hope to see all of you again in our next Inner Circle session. Till next time, thank you very much. Thank you all for attending today's session.